Of course, all the smoke from those fires can be hazardous to your health.
Yeah, and according to IQ Air, Denver, the 10th most polluted city in the world right now. Your reporter in northern Colorado, Dylan Thomas, to talk with health experts about those dangers. And Dylan, it is hard to breathe.
Yeah, and believe it or not, the town of Breckenridge is on the mountain line right here behind me, but you can't see it because of the thick haze. Normally you could. I was just there the other day, and man, the air quality was rather poor. But compared to the air quality here in Larimer County, you might be thinking, well, it's perfectly safe to go outside and enjoy your time, and that there isn't any health threat. But those with UC Health say that's not exactly the case, and they can prove that through the increased number of patients they've been seeing in their facilities.
We've definitely seen more people with reactive airway disease come into our urgent cares who are experiencing increased shortness of breath and difficulty breathing, sometimes chest pain or pressure.
And medical professionals with UC Health in northern Colorado say that is a direct cause of the fires burning to our west and southwest.
For the most part, the people who are at risk are people with like COPD, reactive airway disease, asthmatics, people who are at just increased risk of experiencing increased shortness of breath anyways.
Physician assistant Katie Simon tells us symptoms could be as minor as a scratchy throat or itchy eyes. It can also be much more severe.
Sometimes they can feel inflammation in their upper airway. Increased coughing can be a symptom.
Those with severe symptoms like chest tightness or shortness of breath may be advised to visit the emergency room, while those with lesser symptoms might be fine with going to an urgent care.
Those smoke particles travel far, and the particles in smoke are very, very small. So not only can they travel a really long distance, they can also bypass your natural immune system and get into the lungs when you breathe them.
Which is why Simon encourages people to make sure their prescriptions for things like inhalers are ready to go.
Make sure that those prescriptions are up to date and filled and kept in your home so that they're immediately available if you need them.
Some people may be thinking, I'll just put a mask on and I'll be fine, right? Well, if you remember those rectangular blue and white masks a lot of us would be wearing during the pandemic, or even the cloth masks, those with UC Health say those are no good when it comes to protecting yourself from particles currently in the air. They are so small that you actually need an N95 mask or even a respirator to be able to help avoid those. Reporting live in Larimer County, I'm Dylan Thomas, covering Colorado First.